What is motion sickness? Motion sickness is a condition consisting of a group of symptoms that are triggered by a perceived sense of movement or actual movement. Common symptoms include sweating, nausea, vomiting, and dizziness lasting from hours to days. How does motion sickness come about? To help better understand this condition, it is important to first get a basic understanding of how the body helps maintain its balance. There are two major components that work together to ensure that the body is able to accurately maintain its position and balance in relation to the ground. These are the sensory receptors that help relay information to the brain and the brain itself. What are these sensory receptors? The body relies on receptors to help provide sensory input to the brain to help adjust the body's position in relation to the floor in order to maintain balance. There are three major receptor systems in the body that are crucial in maintaining balance: the visual receptors, the eyes, the auditory receptors, the ears, and the receptors on the feet. The eyes contain visual receptors that help provide the necessary visual sensory input to the brain through a special nerve called the optic nerve. The brain then uses the visual input to adjust the body's posture relative to the ground to maintain balance. The ears contain a very important group of structures collectively known as the vestibular system. The vestibular system consists of three main structures called the semicircular canal, the utricles, and the saccules. The semicircular canals consist of fluid-filled tube-like structures lined with hair-like receptors. These hair-like receptors sway in various directions in response to specific rotational body movements. The swaying motion of the receptors in turn transmits precise positional sensory signals to the brain to help maintain balance. The utricles and saccules likewise also consist of fluid-filled tube-like structures lined with hair-like receptors that are coated with tiny little floating calcium carbonate crystals. The orientation and position of these calcium carbonate crystals at any moment in time is solely dependent on the direction of force of gravity. Therefore, the utricles and saccules are crucial in detecting and responding to changes in the position of the head in relation to gravity and adjusting the head position accordingly. The sensory receptors of the feet. The feet help maintain balance because it contains vital receptors called proprioceptors and vibratory receptors. The proprioceptors are receptors located in the hands, fingers, feet, and toes that help provide precise information about the position and orientation of the limbs and other body parts in relation to the environment. The vibratory receptors help detect vibratory movements in the surroundings. Signals from these receptors are then sent to the brain and used to help maintain overall body position and balance. Finally, the brain itself is critical in maintaining balance because it helps process, interpret, and respond to sensory input signals from the sensory receptors in the body. The cerebellum in particular is a region of the brain that specifically helps maintain overall balance and precise movement of the limbs. So what happens during motion sickness? During motion sickness, there is a disconnect between the visual sensory input signals the brain receives through the eyes and the positional sensory input signals the brain receives via the vestibular system in the ear. Hence, the brain experiences a sense of confusion, which leads to feelings of nausea, sweating, etc. What are the common symptoms patients may experience? Dizziness, nausea, and vomiting, headache, room-spinning sensation also known as vertigo, sweating, and heart palpitations. How do we diagnose motion sickness? It is diagnosed based solely on the description of symptoms experienced by the patient, the symptom triggers, physical exam findings demonstrated by the patient. How do we treat it? Treatment of motion sickness is based on a multidisciplinary approach. This involves educating the patient on preventative strategies to help decrease the frequency of symptoms, such as avoiding or limiting exposure to triggers, avoiding reading a book while in a moving vehicle, not staring at your phone or personal computer while in a moving vehicle. In patients with severe or persistent motion sickness, medications can also be used to better control these symptoms. Such medications include antihistamines such as meclizine and Benadryl, and anticholinergics such as scopolamine, etc. Here are a few questions you may want to ask your doctor if you have been diagnosed with motion sickness. What is the cause of my symptoms? Can these symptoms recur even after it is treated? Can I pass on motion sickness to my children? What are my treatment options, and are they effective in completely eliminating my symptoms? What can I do to prevent these symptoms from occurring or recurring? Can a stroke cause similar symptoms to motion sickness, and if so, how do I tell the difference? What should I do if I think my symptoms are due to a stroke? Here are some take-home points on motion sickness. Firstly, it is caused when there is a neurological disconnect in the brain between the sensory input from visual stimulus and the positional sensory receptors in the ear. Secondly, symptoms including the feeling of nausea, dizziness, are usually triggered by a perceived sense of movement. Thirdly, this condition is diagnosed based on the description of symptoms experienced by the patient and the known triggers. Finally, treatment of motion sickness focuses on avoiding triggers, in addition to controlling symptoms with anti-nausea and anti-dizziness medications. Ready to try a few practice quiz questions to test your understanding? Question 1. What is motion sickness? A. It is a type of headache accompanied by severe arm pain. B. It is a type of stroke that is caused by uncontrolled high blood pressure. C. It is a type of dizziness caused by sudden head movements. D. It is a set of symptoms that are triggered by a perceived sense of movement. E. It is a type of severe headache that is triggered by moving bright lights. Answer is D. It is a set of symptoms that are triggered by a perceived sense of movement. Question 2. Motion sickness can be triggered by which of the following? A. Reading a book while in a moving vehicle. B. Drinking too much coffee. C. Sitting in a hot room. D. An ear infection. E. Strong odors or smells. Answer is A. Reading a book while in a moving vehicle. Question 3. Which of the following is most crucial in diagnosing motion sickness? A. An eye exam. B. An ear exam. C. An MRI brain imaging. D. A drug test. E. A thorough description of the patient's symptoms and when they are triggered. Answer is E. A thorough description of the patient's symptoms and when they are triggered. Question 4. Which of the following is a medication that can be used to manage motion sickness? A. Insulin. B. Penicillin. C. Meclizine. D. Metformin. E. Aspirin. Answer is C. Meclizine. Question 5. Which of the following are symptoms of motion sickness? A. Fever. B. Loss of hearing. C. Nausea, sweating, dizziness. D. Severe joint pain. E. Loss of sense of taste. Answer is C. Nausea, sweating, dizziness. Thank you for taking the time to learn with us today. We trust that the information presented was of help to you. If you found this information helpful, click the subscribe button for more. Until next time.